Hello and welcome back to another episode of the Homage web series. So, in this edition, we'll be talking about speech therapy. My name is Sarah, and today I'm joined with Stephanie Teh. So, Stephanie is a speech therapist with experience in Australia and Malaysia. She's graduated with a bachelor's degree in biomedicine and has a master's degree in speech pathology from the University of Melbourne. And Stephanie is also a member of the Malaysian Association of Speech, Language and Hearing. So, hello, Stephanie. It's such an honor to have you with us today.
Thanks for having me.
So, thank you again for joining our Homage web series. So, we'll be talking about speech therapy. So, to start off, Stephanie, could you maybe tell us about speech therapy? So, what exactly is speech therapy?
So pretty much speech therapy is like physiotherapist or like occupational therapist. We work with people with swallowing or communication difficulties. So for example, someone who suffered a stroke or an accident and they need to be fed through a tube. So that's where speech therapists intervene, and then we provide some strategies and some practices or some exercises to regain their ability to swallow. Or if it's with children with learning difficulties, autism, ADHD, they just need that extra support from a speech therapist just to pick up the language, pick up the speech. That's where we could also offer our support or our services.
I see, right. So, as you mentioned, those are the kinds of medical conditions that would require speech therapy?
Recommend it, yeah.
I
We would recommend, yeah.
Mm-hmm. Right. And so, why is it that speech therapy is as important as other therapy services, like physiotherapy or occupational therapy?
I think it's been a myth around that physiotherapy or occupational therapists can also do the work of speech therapy, because it's at the end of the day, let's say if we're talking about adults population, at the end of the day, it's about rehabilitating what was lost. But I think the biggest difference is that speech therapy is actually trained in terms of only this area. So we are focused on specifically the oromotor muscles, which is for chewing, for eating, for speaking. We are also trained in specific, like the voice box, which is for voicing, phonation, and we also identify areas on how to best allow communication. And often speech therapy are usually trained in that area that they can find out the best, or I guess the most effective way in offering in terms of rehabilitation.
So, you mentioned a lot of muscles in your mouth area. Could you walk us
Yeah.
through some of the terms, some of the common terms in speech therapy, that family members or caregivers should know?
If we're talking about the adults population, which I'm specialized in, there are 3 to 4 big words that often doctors will use, or even speech therapists. The first one is called aphasia. Aphasia is a language difficulty caused by a brain damage, so either by a stroke or traumatic brain injury, an acquired brain injury whatsoever. It usually impacts a patient's ability to express themselves or to understand. So the muscles may work fine, but they're just not able to get the words out, or they're not able to understand. It's not because they don't want to, it's just because the language area in the brain is affected. So then they can't, they physically can't understand, or does not have the ability to express their message. So that is aphasia. Another one is called dysarthria, which is a speech difficulty caused by a brain injury as well. So dysarthria is the complete opposite of aphasia. So meaning the person's brain is working fine. The only thing that's impacting them is their ability to move the muscles. So causing them to have slurred speech or unclear speech, we can say it. For example, some patients after stroke, they have a one-sided weakness. So imagine if you have one side like that and the thing on that, it's not really clear, but they know what they're saying, they know what they need to say, and they understand. It's just that whatever that's being said is not clear. So those are the 2 bigger terms when it comes to communication. The other term is called dysphagia, which is a swallowing difficulty. Often, again, it's caused by a brain injury, caused by stroke or traumatic brain injury or acquired brain injury. Dysphagia, it just means swallowing difficulty. So sometimes patients has drooling after a stroke or after a brain injury. They're not able to chew. They're not able to swallow well. They choke on water. They choke on their food. They cough a lot of secretion building up, not being able to clear. Such and such is how we categorize someone with dysphagia. Yeah.
Yes. So with aphasia, right, it's an impairment in the brain,
Yeah.
right?
So it's an impairment in the language area of the brain.
And so when should family members or caregivers actually seek out speech therapy for their loved ones?
Usually, I would recommend immediately after a stroke or any TBI, ABI, any injury at all. It would be best to just get it checked out by a speech therapist, and then they can probably recommend you whether or not you need a follow up, or we could just discharge you from speech therapy, because everyone is different. It's really hard to give you a one size fit all answer. If that is not, if speech therapy is not a service that you are able to get hold of immediately, then if you notice that the patient is having difficulty eating, they're losing weight, drooling is happening, but they're not able to clear it, then that's when you can seek out. Or either when someone, you notice when they're trying to say something but they're not able to get the message out, feels like a short-term memory loss, like they just can't get what they want to say, or when they don't understand what you're saying, they just cannot focus on what you're trying to say, or when someone is speaking and you cannot understand at all because it's too slurred, like it's just unclear. So that's when you can probably also seek out a speech therapist.
Right. So those are the definite signs that one should seek out speech therapy. Yeah.
Yeah.
Right. So can you walk me through like what actually happens during a session of speech therapy?
Yeah. So usually in an assessment, an initial assessment, the speech therapist will probably start out with a case history. So just to get to know the patient a bit more, in terms of their condition, what's happening at home, what was their life before, this traumatic event, and then that kind of gives us a clue on where to guide the patients in terms of their goals as well. So knowing that, maybe they're young and they're energetic, they want to go back to work, that could be a goal. Or, if they're just slightly older, they just want to have a good quality of life. That's the case history part where we just get to know the patient a bit more as a person. And then after that, we often will do what we call an oromotor assessment, which is a cranial nerve assessment, which allows a speech therapist to have a look at the muscles of eating and speaking. So it allows us to assess which nerve is impacted or which muscles is not working as effectively. So that also gives us an idea on whether or not we need to, prescribe some exercises to strengthen the muscle, or techniques to overcome, or compensation exercises, compensation strategies to overcome what was lost. That's usually in the oromotor. And then after that, we would often do a swallowing bedside assessment. So meaning give them some food and some fluids, and then we'll see how well they can tolerate the eating, the food or the drinks. That is for the swallowing part. And then often we'll always do a speech or language assessment. So meaning identifying specifically which area, is it a speech area or is it a language area that is impacted? And then if it's a speech, specifically which sounds they're not making. So for example, some patients, they can't make the t sound, the T sound again. So then we got to teach them how to use the tongue. Where do you place the tongue? How do you exercise the tongue so that you can regain that sound again? Or if it's a language, then we can give them some techniques or some strategies, even to family members, so that they know how to communicate with them. Because at the end of the day, they're still a human being.
Yes.
We shouldn't strip away their rights to communicate. They should be able to communicate anywhere and anytime that when they want to. So family education often happens in the first session as well, teaching them what to expect, what to do at home, what's the best what's the best outcome, or what's the best plan moving forward. And then usually at the end we'll discuss some goals, and then we'll see where we move towards.
Right. And do family
Yeah.
members play a big part in like the speech therapy?
Definitely, because seeing a speech therapist once a week, twice a week is not enough. You need the family support at the end. You need the family or the caregiver doing the exercises every single day as much as possible in order for them to actually grow and to rehabilitate what was lost.
So what are the things that family members can actually do to help support, their loved ones who are going and seeking speech therapy?
Yeah, it's actually really hard to give you again a one size fit all answer because everyone's experiencing different things. So everyone have different ways of compensating what was lost. At the end of the day, I would say just being present with the patient, showing them that you care, showing them that you are always there is the best support that I can say. Other than that, specific exercises, it's really individualized. It depends on the weakness. It depends what was lost. Yeah.
I see, yes. And so with the boom of the internet, right? Does speech
Yeah.
therapy also like move to online as well?
Because of this pandemic, I've got to say, in Malaysia, yes, we are slowly developing, slowly growing into telehealth. But then when I was working in Australia, it's actually a very common instrument for us to use. It is starting to grow in Malaysia because of the pandemic, because of lockdown, MCO. So yeah, in general, I would say yes, it's slowly growing into internet.
Yeah, right. That's great to hear, and hopefully it does grow, Yeah. Right. And so there are some common misconceptions surrounding speech therapy that we'd like to address, right?
Yeah.
And so the first one is that speech therapy is only for individuals who stutter or have lisps.
That is often what people think so, but not really. So when we talk about children, so often this happens in children. There are so many factors that can actually affect them. For example, if someone is diagnosed with autism, they definitely need some support in some areas in terms of language development or even in social cues, social communication, learning how to interact with other people, learning how to request such and such. All these social cues, they are also part of speech therapy's area. So not only stuttering, I would say that is for children, and if it's for adults, similarly, it's not only for stuttering or lisp. It's for someone who has swallowing or communication difficulties.
Okay. And so the second common misconception is that speech therapy is just all about talking.
It is very true. Everyone says that. Again, no, it's not just about talking. It's actually about communication and swallowing. But let's just talk about talking. When someone says talking, all they can think about is just verbal speech. But communication is broader than just verbal speech. Communication can mean writing, it can mean gesturing, it can mean using, an iPad to type it out or a computer to type it out. There's so many ways for someone to communicate, and that's where speech therapy comes into place. So for example, Stephen Hawking,
Yeah.
he is someone who definitely benefit from speech therapy because he is actually communicating using a device and a finger. So that is part of a speech therapy and an OT's work to find out what's the best way for someone to communicate. So like I said, communication is for someone to be able to express their message anytime, anywhere, with anyone.
I see.
Yeah.
Right.
Mm.
Okay. And the third common misconception is that an occupational therapist or a physiotherapist are also able to help work with swallowing and talking.
Before speech therapy actually kicked in, they may offer some sort of support, I guess. But I would say no, especially if we're dealing with swallowing, because swallowing can be quite detrimental, especially if we have food or liquids going into our lungs. That's where you actually need a professional speech therapist, a certified speech therapist to actually come in and tell you if the patient is safe for eating or drinking. And when it comes to exercises, yes, sometimes physiotherapy do offer some massage, some TMJ massage or stimulation. Those are really helpful, but it may not be the most effective solution. That's what I would say.
Mm-hmm. I see.
Yeah.
Right. And do occupational therapists or physiotherapists also work alongside speech therapy?
Definitely. So the best way for someone to actually recover is when a multidisciplinary team works together. Because if I'm just going to work on the speech therapy myself and I don't work on the endurance, a patient may not be able to complete a full meal because he doesn't have the endurance to sit up right. So that's where a physio comes in. So the physio is going to work on the endurance, for example, so that he is able to sit upright. And then OT comes in because how is a patient going to feed if they don't have the upper limbs? So the OT is going to come in to train, the fingers and the hands so that they can feed themselves. Even if it's not feeding, they could just train on the cognition so that they know they're alert. The patient's alert on what they're doing. They know what they need to do during feeding time, for example. So yeah, definitely OT, PT, we should all work together.
Right. Definitely a collaborative process. Right.
Yeah, definitely.
Right, so thank you so much, Stephanie, for sharing. I think you really shed a lot. I think I've learned so much myself. Yeah, it's been really informational and
Most welcome.
educational. Right, so yeah, we really appreciate all the information and insight that you've brought. I'd just like to put out a little disclaimer that this health information is just for general informational purposes, and it cannot replace or substitute a professional medical advice. Yeah, so if you do need medical attention, please do seek out your nearest hospital and doctor to obtain medical assistance.
Thank you so much.
Thank you.
All right,
Take
bye-bye.
care.
Take
Stay
care.
safe. Bye.